I am Dr. Shreedevi K N. I am a consultant surgical gastroenterologist working in Bangalore in Chirag Global Hospital. So there are, very broadly speaking, two types of hemorrhoids. There are internal and external hemorrhoids. When we talk about grading, we usually talk about the internal hemorrhoids, where we have grades 1 to grade 4. So there is no strict rule that grade 1 hemorrhoids have to be treated with medicines and grade 4 have to be treated with surgery. It completely depends on the patient. So we have a very tailor-made approach. Patients with grade 1 can have severe bleeding, and some patients who have grade 4 hemorrhoids from plenty of years may not have any symptoms at all. So it depends on the patient and depends on what symptoms they have that we suggest the line of treatment for the hemorrhoids. So when we talk about medical treatment for hemorrhoids, we have plenty of options. We have local applications such as creams. We have some syrups which will help in making the stool soft and easing the passage of stools. And then again, we have some medicines which target the hemorrhoids itself and reduce the congestion and the vascularity of the hemorrhoids, which will shrink the hemorrhoids in size and thus relieve the patient of all symptoms. So when it comes to medicines, depending on what symptom you have. So for example, if you are somebody who has very hard stools and strains a lot to pass stools, then you will benefit from some stool softeners or laxatives which will make your stools soft. So once your stools are soft, then you will be able to pass them freely. You will not need to strain, and hence your hemorrhoids will improve. If you are somebody who has mild bleeding, then there are separate tablets or syrups which we can give you which will reduce the bleeding. Some patients may have severe pain. So generally, when a patient has a lot of pain, a lot of swelling or severe bleeding which cannot be controlled with medicines, then these are the type of patients in whom we advise surgery. So what are the various ways in which hemorrhoids can be treated by surgery? So whether we do an infrared procedure or a laser or a stapler, so all these procedures will come under surgery. So some newer advances such as laser, they can be done in an OPD setting, meaning that they do not require a lot of anesthesia. They can be done under local anesthesia, and they can be done as an OPD setting where you can undergo the procedure in the morning and then you can go home and resume your activities in the evening. So the options for these include, one is infrared coagulation, where we use infrared to shrink the size of the hemorrhoids. Then of course there is cryosurgery, where we use cryotherapy to shrink the size of the hemorrhoids. Then there is something called as a rubber band ligation, where we use rubber bands to reduce the size of the hemorrhoids. There is sclerotherapy, where we inject certain chemicals into the hemorrhoids to again shrink the size of the hemorrhoids. And of course laser therapy, there are different types of lasers where we can use it either to coagulate, or meaning to shrink the hemorrhoids, or to excise hemorrhoids that are very large and that cannot be just shrunk. When it comes to more invasive surgeries, there are stapler surgeries and there are open surgeries. So stapler surgeries is where an entire ring of tissue along with the hemorrhoids is removed using a stapler. And then there are open surgeries where several energy devices, so it can be a radio frequency unit, it can be a laser, it can be your bipolar, or it can be an electrocautery. It can be even ultrasonic harmonic scissors, scalpels. So there are different sort of energy devices in which the enlarged hemorrhoids can be removed. In the traditional setting, it used to be done with knife or scissors, which used to be painful and it used to cause a lot of pain for the patient, especially during recovery. But now that we have these reformed electrical energy devices, the pain and the recovery is much less and the patient can resume their activities on the very next day. I think in this day and age, there are plenty of creams available for every situation. So there are some hemorrhoid off the counter, below the counter, there are a lot of medicines given out which may or may not have any medicinal value at all. But the ones that are sold in pharmacies, they can have a lot of composition. So they can have steroid creams, they can have just local anesthetic creams, there can be creams with just some sort of thrombolytics in them. So I think before you use any creams or any medicines for hemorrhoids for that matter, kindly consult a surgeon so you know that what you have is indeed hemorrhoids and whether or not creams will help you for that particular reason. Okay. Not all patients with hemorrhoids will require surgery. Most of the patients will respond to a good change in their diet and lifestyle habits. So if you take good water and fiber, if you have some exercise, and if you avoid straining while passing stools, majority of the patients will not experience any further symptoms when it comes to hemorrhoids. However, if you are somebody who has been diagnosed with a stage of hemorrhoids where you require surgery, then there are plenty of options available depending on what your problem is and how it can be managed best. So for some patients, just a laser or an infrared coagulation may be enough, but some patients may require even complete removal of the hemorrhoids. So you have to consult your surgeon so that they can decide what sort of treatment, and if you do require surgery, what sort of surgery will best suit you. Home remedies are something that all hemorrhoids patients have tried and tested for at least a few days to anywhere between a few months and a few years even before they come to a surgeon to ask for help. So if you are somebody who is experiencing discomfort, if you have pain, swelling, bleeding, please make sure that you have got the diagnosis first before trying any home remedies. Because if you do have hemorrhoids or if you do have a small clot in your external hemorrhoid, for example, so then yes, this will respond to a warm sitz bath or warm baths taken at home or any local home remedies that you may be taking. But if you are not sure what you have, if you have some pain, swelling or bleeding and you don't know why you have it, then it is better not to take any home remedies, but to first consult your surgeon and make sure that you have a reason, you have a diagnosis for your symptoms, and then after you take their advice, you can go ahead and use home remedies. If you want to get a relief from your symptoms very quickly, then to be very simple, just follow the advice of your surgeon. So it may be simple home remedies, few tablets or some syrups, or it may require surgery. So please follow the instructions given to you and I'm sure you will be relieved of your symptoms very quickly.